As someone who has dedicated their career to helping people navigate the complexities of personal finance, I can confidently say that one of the most overlooked yet pivotal decisions we make each year is during open enrollment. With healthcare costs skyrocketing, this choice isn't just about picking a plan, it's about protecting your financial future. But here's where it gets controversial. Many of us are winging it, and the consequences could be devastating. Let me set the stage for you. As a certified financial planner and someone who reports on personal finance trends, I spend countless hours dissecting how to save money on medical expenses, a topic that grows more urgent every year. Health insurance remains one of the most valued employee benefits out there. Yet surveys consistently show that too many workers breeze through the selection process without much thought. For instance, nearly a third of those enrolled in health insurance spent less than half an hour choosing their plan in 2024, according to research by the Employee Benefit Research Institute. And if that doesn't raise eyebrows, consider this. Almost half of millennials admitted they blindly picked plans simply because they didn't understand them, as revealed in a separate survey. Now, let's talk about why getting this decision wrong matters so much. Healthcare costs aren't slowing down anytime soon. In fact, large employers anticipate these expenses will rise by 9% in 2026 alone. Right now, companies cover between 75% and 85% of health plan costs, leaving employees to foot the rest through premiums and copays. However, financial experts warn that as costs climb, businesses may pass even more of the burden onto workers. This shift means your choices during open enrollment could have a bigger impact on your wallet than ever before. So what am I doing differently? Well, preparation is key, especially when uncertainty looms over future medical needs. One strategy I swear by is tracking my annual out-of-pocket healthcare spending. Yes, it sounds tedious, and it kind of is, but it pays off when it comes time to select a plan or decide how much to contribute to a flexible spending account, FSA. By reviewing past expenses like copays, prescriptions, and other medical bills, I gain valuable insight into what might lie ahead. Plus, keeping detailed receipts helps at tax time, though claiming the medical expense deduction isn't common since it requires itemizing deductions and meeting specific thresholds. Here's another layer to think about. Should you pay more upfront or later? Most health plans boil down to two options. You either pay higher premiums now or face a larger deductible later. Personally, I use my tracked data to determine which route makes sense for the upcoming year. If I'm generally healthy and don't expect frequent doctor visits, opting for a high deductible plan often saves me money. Many plans also cover preventive care, such as annual checkups, without requiring me to meet the deductible first. On the flip side, if I foresee needing multiple treatments or surgery, a lower deductible plan with higher premiums starts looking attractive. One tool I always leverage is my FSA. These accounts allow me to set aside pre-tax dollars specifically for healthcare expenses. It's essentially like giving yourself a discount thanks to the tax savings. The catch? You must use the funds within the calendar year, or risk losing them, with only a small portion allowed to roll over. To avoid surprises, I track my FSA spending monthly. Data shows that the average household contributes around $2,250 annually to their FSA, and most people aim to spend the bulk of it by November. Before working at CNBC, I was self-employed for 6 years and relied on a high-deductible health plan purchased through healthcare.gov. During that time, I discovered the power of a health savings account, HSA, which acts as a long-term safety net for medical costs. Unlike FSAs, HSAs let you roll over unused balances year after year. Even better, some accounts allow you to invest the funds for potential growth. With 3 layers of tax advantages, pre-tax contributions, tax-free growth, and tax-free withdrawals for qualified expenses, HSAs are hard to beat. Yet surprisingly, despite 2/3 of companies offering investment options for HSAs, only 18% of participants actually take advantage of this opportunity. This brings us to an important question. Are we truly making the most of the tools available to us? While navigating open enrollment can feel overwhelming, taking the time to educate yourself and explore all your options can lead to smarter decisions. and potentially significant savings. So tell me, do you feel equipped to tackle this year's open enrollment season? Or do you think there's room for improvement in how employers communicate these choices? Share your thoughts. I'd love to hear from you.